All right, good morning. It's good afternoon back in Alabama, but it's good to see everyone here, and it is my distinct pleasure to serve as moderator this morning. I'm Robin Lanzi, professor of health behavior, psychology, and adolescent medicine. Have the wonderful pleasure of serving as MPI with Michael Magavero and Larry Harold for our UAB CFAR Implementation Science Hub, and really enjoyed this ride since the beginning with ISKI and the other hubs, and it's been a great time, and I am looking forward to introducing our panelists now. So delighted to introduce Dr. Sannisha Dale, an assistant professor with tenure in psychology at the University of Miami, where she holds a secondary appointment in public health sciences. Dr. Dale is a licensed clinical psychologist and the founder and director of SHINE, which stands for Strengthening Health Through Innovation and Engagement Research program. She's a passionate researcher focused on resilience, trauma, health inequities, and health outcomes for those living with HIV and those placed at risk for HIV. Engaging community members and stakeholders is at the heart of her work. Joining us as well is Glenn Stepherson, who from Empower You Community Health Center, serving as an outreach worker and artist linkage coordinator with over 2 decades of dedicated work in the field. Glenn brings a personal commitment to HIV education and stigma reduction, driven by his deep and personal connections to having lost loved ones and friends to HIV. Next, we have Dr. Jessica Sales. She is an associate professor at Emory's Rollins School of Public Health, where she's director of Emory's CFAR Implementation Science Hub and co-director of the implementation of the Emory CFAR Prevention and Implementation Sciences Core. She is deeply involved in IS research with 3 NIH-funded implementation science projects focused on the integration of evidence-based practices, including PrEP and trauma-informed care, into the clinical settings across the southern United States. We are also pleased to welcome Dr. Catherine McApagel. I was practicing. She sent me an audio recording too, and I was like, please let me know. Associate professor in the Department of Medical Social Sciences at Northwestern University. She is co-director of the Developmental Core, specializing in the intersection of social media, technology, and sexual health for sexual and gender minority adolescents. She is deeply involved in designing and disseminating innovative HIV prevention programs. And finally, but not least, we have Jim Pickett, a seasoned consultant focusing on prevention research and implementation advocacy. He brings his expertise in engaging teens in sexual health education through creative and empowering approaches. His work continues to inspire and inform HIV prevention on a global scale. So let's give a warm welcome to our panelists. So, yes, thank you.
Hi, everyone. They gave a nice intro, so I won't belabor it, but thanks for having us, and I hope you're all hanging on the best you can.
Hello, everybody. My name is Glenn Stepherson. Again, thank you for allowing me to be here with all of you.
So just 2 quick disclosures on my end. I have served as a site PI for a Merck-funded study and also been a consultant on a work group for Gilead Sciences. So I always want to acknowledge the many people behind the work. So this is just an image of members of the SHINE research program, but we're a relatively big team of both core research staff, early career folks, and also undergraduates and graduate students and community voices, consultants, et cetera. So the 5-point initiative, I want to give a bit of history to those who may be in the audience and are on their first EHE supplement or second. This work has been funded since the first EHEs were funded. So in 2019, we got the plan and supplement for the 5-point initiative, and then thereafter we got the 2-year implementation science supplement to expand that work. And currently, mid last year, we got an R1, which is we're using to conduct a bundled, a cluster randomized, a cluster RCT using to examine the bundled implementation strategy to really see how effective it is when we're looking at it in specific zip codes. And we're using a step wedge design to enter 8 high-impact zip codes in Miami into the 5-point initiative. And so to get to the crux of, what exactly is a 5-point initiative, I know you can't zoom in on the logic model, but in very simple terms, what different aspects of it look like is it is coordinated outreach, but coordinating in the essence that it includes certain key voices. So there are community businesses. So over the years, we have partnered now with over 80 community businesses. And those businesses include a lot of mom and pops kind of stores in Black communities. So corner stores, barbershops, car service providers, like gas station and so forth, laundromats, and also beauty supply store and hair salons. So we coordinate with local big businesses, and they become our business partners. There are also community health partners, and Glenn's going to tell you a lot about one of our favorite community health partners. Actually, we love them all. No favorites here. But we also collaborate with community health partners who are already funded by different federal agencies to do work, and I'll tell you about the benefit for them in a second, but we've partnered with over 8 over the course of this work. The residents are also a key part of how we think about this approach and strategy. We not only give them a brief survey to get at socio-demographics and other key variables as we do this work, but we're actively listening and eliciting feedback from them in terms of how we can improve the approach and the work that's being done. And also community consultants. We don't have a community advisory board. We have community consultants that are paid for their time to bring their expertise consistently across the project. Another key part of how we do this work is within SHINE itself, we're hiring people who are of lived expertise and proximal to the communities that are most impacted in Miami. And then what? So we have these coordinated events where we coordinate with the local businesses. So say it's a laundromat today, and we're there for a window of 4 hours. Our community health partners come in. Usually we have at least 2, and we've learned that over the years because our demand has skyrocketed because of trust building and everything like that, so people easily approach our team. We have 2 community health partners that are there, and what residents see when they approach us and learn about is that they are going to get a cash voucher to spend in that business. It's $25 in exchange for engaging with the team and engaging in the health behavior. And so they complete a brief survey, and then they are tested for HIV by the health partner. They are screened for PrEP, and they are linked to PrEP if indicated as well. Why do people like this model? The cash vouchers, but the daily revenue for the businesses. They're not being asked to do this from an altruistic point of view. There's actually something tied to their business model in terms of revenue. The community health partners also love this model because they've seen increased reach in terms of the amount of people they're able to reach when it's a coordinated event and coordinated effort. And in terms of people with lived expertise, compensation, again, for their expertise in how they do this work. Okay, so Empower You, one of our favorites.
Hello again. Empower You started 2 young ladies living with the HIV virus, decided they'd start their own Ryan White medical case management agency. And in doing so, they took it to the streets. The name Empower You was chosen because that was the mission, to go out in the streets and empower other minority women and those less fortunate to take control and manage their HIV positive status. They did it with a passion. I have to tell a little bit of my story because also I worked for a number of years in law enforcement. I didn't start out with health care, okay? And I took a left turn in life, became a drug addict, became a homeless drug addict, and in my return back to society, I found out that I was losing people, family members, my little sister, to this virus. Okay, and today I know that it was the stigma that killed her. It was the stigma, and so that's my passion today. I joined Empower You in 2003, I attempted to, well, not attempted, but I got into addiction counseling, went back to work, went to school, went back to work, addiction counseling, and upon my return, a lot of my clients were HIV positive. In doing referrals, making referrals, and trying to link them to care and get services for them, I ran across Empower You. And then Ms. Mills, who's still there today, well, she's not there today, but Ms. Mills at that time, she offered me a job and said, hey, you seem to really care about these people. And I said, yeah, I do. And she noticed that, and she offered me a job, and I said, no, I'm good. I'm following my addiction counseling. But I did take the job, and in doing so, I bought into the passion. How do we say, following up. We took it to the streets. And I bought into it. That's what I can say. I did. I bought into it. And today, I am in the fight still, 20 years later, with Empower You to educate, to empower folks to take advantage of, take control of their HIV positive status. Also, Empower You, working with Shine, it has been good. It's been a good collaboration. And just as she explained, it gives us an opportunity to reach out to a lot of people. And when you're doing just an HIV testing event, it erases the stigma. It erases the shame. People come forward. And what I say today, true confessions. When people are normally at any other health fair where there are other agencies there providing other services, they don't stop at the HIV truck. They don't come to the HIV table. But when you have an event where it's nothing but just HIV, people open up. People come in, and you find that a lot of people need help. And since the COVID pandemic, a lot of people were disconnected from care because they weren't able to access telehealth. They weren't able to use the technology that we have today. And so they became lost to care. And these people that are still out on the streets needing help, today this agency still stands for that, what I say, where there's a core group of us that are still there to say, we still have the doors open for those people. A lot of agencies today turn those people away, not Empower You. We still take those folks in, the homeless, the crack addicts, the sex workers, everyone. We don't turn the door, we don't close the door to anyone. The only problem is insurance. Sometimes insurance gets in the way. But events like Shine, yeah, it makes it possible. It makes it possible. And I'm glad to be a part of Empower You because now I'm able to be able to, like I say, get out in the fight and save as many people as I can. Amen? Amen. Thank you.
I'm not going to add much more to that beautiful speech, but I will say that we have been partnered with Empower You forever, and we've reached over 4,000 residents to date in doing this work together. And we're always outside. We bring a lot of love, a lot of passion, a lot of teamwork, and a lot in terms of we're here because we want to be here. And I can't recall her name, but someone started off with a Cornel West quote in the beginning in terms of, you know, you can't make change unless you're doing it out of love and actively wanting to empower and uplift communities. And so we get out there and we shine with smiles, be it rain or sunshine. And just thank you to everyone. Thank you, Glenn.
Oh, thank you. Thank you for having me.
Thank you. I think we'll save questions to the end. Invite Jessica Sales to come up, please.
Okay. I think it's afternoon, close to almost afternoon. Thank you for having me today. I'm really excited to be here to share some of the work that we're doing here back in Atlanta. I don't have anything to disclose, but I do want to acknowledge the funding that I've received with my collaborators for the work, and also to acknowledge my full study team, including my MPI and partner in all things PrEP access for women in Atlanta, Anandi Sheth, and then our community partners, Sarah Sullivan and Dazon Diallo from Sister Love, who I'm going to share about our work here in just a moment. So despite the efficacy of PrEP and its potential appeal, right, to women because it's user-controlled and could be used discreetly, PrEP remains underutilized by women across all regions, as we've heard about already today, but especially so in the southeastern U.S., where the epidemiological burden of HIV among women is highest, such as in the 4 EHE counties that make up Metro Atlanta, where the work that I'm going to talk about takes place. So key challenges for reaching women with PrEP in the South are that women's healthcare providers, such as the Title X funded family planning clinics that are the focus of a lot of the work that we do, aren't providing PrEP, and cisgender women have low knowledge about PrEP as a prevention option that is available and appropriate for them. So that's the goal of our work, which was first funded by a 1-year EHE planning grant supplement in 2019, was to mount a coordinated, collaborative approach to sustainably addressing both the supply and demand challenges for reaching cisgender women with PrEP across Metro Atlanta. Oops, there we go. So in our supplement, we identified our community partners right away because we'd been working with these two groups for a number of years before the EHE initiative began. Specifically, we partnered with Sister Love, which I don't know, how many of you have heard of Sister Love? Yay, okay, see the reach that she has in their group. It's an Atlanta-based women's HIV reproductive justice organization. They're internationally recognized for raising sexual health and HIV awareness among women, particularly in the south of the US, but also around the globe. And they have deep connections in Metro Atlanta community, as well as are part of a rich CBO network in our community. We also partner with the Georgia Family Planning System, which is Georgia's Title X recipient and the largest recipient in the nation to integrate family planning services into FQHCs across the state of Georgia. So as part of 2022, Georgia Family Planning System provided Title X funds to 31 sites across the 4 EHE counties in Metro Atlanta. So partnering with Georgia Family Planning System is significant as they administer Title X funds to health centers to support the delivery of integrated family planning and sexual health services, including HIV, at clinical sites across the state of Georgia. And as part of their job as the state grant holder, the Title X grant holder, they are charged with developing and building the capacity of their clinical sites to provide evidence-based family planning and sexual health services through training and technical assistance. So in our 1-year EHE supplement, in order to address the PrEP supply challenge in Atlanta in Title X clinics, we worked with Georgia Family Planning System to conduct focus groups with providers and staff from 25 of the 31 clinics across the metro. And we wanted to determine their current HIV testing and PrEP services and PrEP practices to identify training and capacity-related needs that they might have that we could fill in those gaps with. With that knowledge, we then worked with Georgia Family Planning System to create a menu of tailored trainings, technical assistance protocols, and patient and provider-facing resources that could be developed and provided by Georgia Family Planning System to their Title X clinical sites. In that same year, to lay the groundwork for addressing PrEP demand challenges among women, with Sister Love in the lead, we worked to build community partnerships with 4 additional community-based organizations that support women's health in order to garner their participation in a coordinated effort to mobilize educational outreach about PrEP and Title X clinics, because a lot of women don't know that they can access free or low-cost services in these Title X spaces. So we wanted to reach a diverse communities of women across these very different counties that make up the metro, and we needed different community partners to do that. So by the end of that 1 year, which was a planning partnership sort of development grant, we had laid the groundwork for launching a coordinated and sustainable solution for addressing supply and demand barriers to reaching women with PrEP and Title X clinics. And we patterned our approach after the interactive systems framework depicted here. The ISF is a model to help coordinate communication and work across agencies, working in collaboration to improve implementation and reach of new practices like PrEP. So in this model, the prevention delivery system, which implements the innovation in the real world, in our interactive system, this would be those 31 Title X clinics in the metro Atlanta area. Then there is the prevention support system, which provides training and technical assistance to support the delivery of those new practices in their sites. For our model, this was the role played by Georgia Family Planning System. And finally, the prevention synthesis and translation system. This group conducts research and distills information about innovations and translates it into user-friendly formats as they work with the prevention support system or directly with diverse delivery sites to facilitate the adoption of new practices like PrEP. So in our system, this role was filled by our Emory research team, and we developed trainings and technical assistance that we then were able to share with and train Georgia Family Planning System to implement in their network. Okay, so the ISF provides a really strong model for strengthening the supply side of PrEP in Title X clinics, but it lacks equally robust attention to the demand side. This was supplemented in our project by innovatively using an evidence-based approach to community organizing to allow communication and feedback from community into each areas of this delivery system as we're building these tools and processes with the clinics. So always keeping community voice and input in mind. So with this groundwork in place, we then received a 5-year grant. We received an EHE R01 in the fall of 2021 to implement our system and evaluate its impact. And thus far, I mean, that sounds like a long time ago, but it really, really wasn't, I promise you. It was almost at the end of 2021, but we have developed all of the trainings and resources from that menu, and we have trained Georgia Family Planning System staff to provide them in the Title X network. So here's a snapshot of the 8 trainings developed from input from those focus groups. We provide these trainings either in person or can be delivered on Zoom. There's also examples of the technical assistance offerings, as well as patient and provider-facing resources on PrEP, all tailored to meet the needs of the Georgia Title X clinics and the patients that they serve. So clinics in this area, we didn't enlist the clinics, right, for this study. We're working with Georgia Family Planning System to see how these services are, what's the adoption of these trainings and these strategies by their network. And they can request any number of trainings, technical assistance, or resources from this menu, which means that they can tailor the receipt of trainings and resources for PrEP to their clinics and their needs. Thus far, we have provided trainings in 21 clinics, reaching approximately 370 providers and staff. We are currently gathering aggregate chart data from all of the Metro Atlanta clinics to be able to evaluate how the receipt of training, so how much they participate in training and technical assistance, how does that impact their HIV testing, STI testing, and PrEP prescribing. And although our focus was on the 4 EHE counties, Georgia Family Planning System also receives requests and provides trainings to sites across the state of Georgia. So they're working with us to focus on these 4 counties because that's the priority of EHE, not the priority of Georgia Family Planning System. But they've been able to deliver trainings across the state of Georgia and have already received and done trainings in Albany, Georgia. Does anyone know where Albany, Georgia is? A couple of folks. It is a very bottom part of Georgia, very rural area of the state with high HIV burden. And so having access to these trainings in other spots of Georgia is really important. So we are also monitoring how much other clinics across Georgia use these services as well. Okay, so on the PrEP demand side, we've worked with our community partners, spearheaded by Sister Love again, to get input through listening sessions with 75 diverse individuals and women across Atlanta, where we use their input and assistance to create content for informal community health education events called Healthy Love Pregame Parties. These are actually something that's built off of Sister Love, has an evidence-based intervention called Healthy Love. And these are just shorter versions of a Healthy Love party that can be implemented by community members in a shorter, abbreviated fashion. So these were designed to be flexibly tailorable to different pockets in communities of women across the metro. But the core focus of all of these sessions is from the feedback we've received from those listening sessions. Women wanted informal opportunities to talk with other women about sex and sexual wellness. And they also wanted to know where they could get services in their communities for free that were near them, from places that they could go and feel like they were heard and could get care. So we created these trainings to meet that need and connect them to Title X services. So we have then assembled a cohort, basically of 2 cohorts of individuals that we call action team members. This consists of 32 community members who we call community influencers. They are ordinary citizens in every respect, that they're not necessarily affiliated with any agency or working in the HIV space, but they were nominated for this role because they are noticed as social influencers in their networks and communities. They have been trained to deliver the Healthy Love pregame parties, and several have already been conducted. I think we've done 10 parties so far. Here's a couple of pictures of those parties, and what we're anticipating in working with these individuals is that we're trying to support them to do 5 to 10 events in a year. And in those events, we see about 10 to 15 participants per Healthy Love pregame party. And we're going to continue to onboard and recruit new cohorts of community influencers or action team members who want to do this short stint through this program where they get a certification and get some acknowledgement that they're doing this through an honorarium. So all to say, we've just launched this, and it seems small and informal and a little bit like a Tupperware party, but that was the goal, because another thing that we heard was that women wanted this information to come from people they trusted in their community to learn about and have these dialogues. So this informal strategy is something that we're going to monitor over time through a brief text message. I know it kills every part of me, the researcher in me, not to ask a really long survey, but also to just be able to get some assessment of how much they are connecting to the community and learning and being able to follow up and sharing information learned. So I know I'm over, but I just want to end that with a couple of generalizable lessons learned is really that the interactive system approach does allow for a scalable, sustainable solution to supporting clinics to implement new practices, especially in environments where there is an established entity, right, for the training needs of the people that they serve, like the Title X program or the Ryan White Network that we've heard earlier. So I'm excited. I'm going to be at the session this afternoon. Please ask all your questions then. Sorry to go over. Thank you.
We'll just switch quickly. Okay, go ahead.
Yeah.
All right.
Okay, I talk fast, so I'll make up some time. Catherine McCapigal, nice to be here with everyone, and I'll be co-presenting with my close colleague Jim Pickett on our, what we've referred to for the last few years as our baby, but now it's a teenager, Prep for Teens, a social marketing campaign. You can check us out while you are maybe listening to me at prepforteens.com, as well as Prep for Teens on Instagram and TikTok. Here are our disclosures, but I wanted to acknowledge our 2020 EHE supplement, funding from the Chicago Department of Public Health, the Alphawood Foundation, the Third Coast CFAR, the Northwestern CTSA, and Department of Medical Social Sciences, which has funded all of this work to date. So basically what I'll be doing is talking about our EHE supplement in like one slide, but we really want to talk to you about how we have taken the research that has come from our EHE supplement and translated it into practice. So And if you want to learn kind of more about the research that we did, I encourage you to scan this QR code, which kind of covers our all of the kind of details and methods. But basically, we won't end the HIV epidemic without focusing on adolescents. We know that PrEP awareness and uptake in teenagers is really limited, and that is messed up. And they do not, we shouldn't have to wait, or these teens don't have to wait for the slow research to practice pipeline when they really need this information now. So that was kind of the premise of our EHE supplement back in 2020. We used this rapid, responsive, relevant implementation research approach to understand what LGBT teens and adult stakeholders who supported them wanted to see out of PrEP campaigns for teenagers. So we didn't know if they wanted them, we didn't know what information they needed, so we just basically asked them as well as a bunch of community members. And it turns out that all of these groups pretty much agreed that it's important that teens need to know more about PrEP, and when they do know about PrEP, they don't know how to access it. Existing campaigns for adults just don't reach teens, and existing campaigns for adolescents that are focused on sexual health or HIV testing often don't talk about PrEP, often don't talk about PrEP very specifically, and often don't navigate teens to resources. And so teens and adults alike really wanted these local, teen and community-driven multimedia campaigns that were not slickly produced, and that were very clear that there was teen and community engagement involved. So after our EHE supplement primary data collection, what we did was we presented our rapidly analyzed data to 7 adolescents recruited from the Chicago area who partnered with or who were taught by a local grassroots LGBTQ marketing professional about social marketing, public health, and advocacy. And we presented our research findings to them about what teens wanted out of PrEP campaigns and basically just let them go for a summer. And at the very end, we really weren't sure, at the end of the summer, we weren't sure what we were going to see from them, but they turned in this beautiful, very well thought out creative brief. You can see some screenshots here that led or served as the basis of our social marketing campaign that we eventually launched in 2023. They talked about who they wanted targeted in the campaigns, what kinds of messages they wanted, colors, fonts, like taglines, all kinds of stuff, and we paid them for their time. So, like I said, this creative brief really guided the development of our campaign. We refer to it all the time. This was back in 2021 that they developed this creative brief. It's 2024, we're still using this. And this is kind of a schematic of how their creative brief sort of looks in practice. So we have across the top here, we have things that really engage people with this campaign: art, murals, public events, talks like this, activations, swag. We have stickers that we can give out to you guys later in the day. We have social media. We're going to launch a community-oriented Discord server this spring. All of this leads to our Prep for Teens website, which is available in English and Spanish, and that is where teens can learn more about PrEP, where they can get PrEP in the Chicago area, learn, read our blog, all kinds of things. And these are our implementation outcomes and sort of clinical effectiveness and behavioral outcomes that we're hoping to see kind of longer term. So we started out with this EHE supplement, and at the very beginning of 2023, we felt like we were sort of stringing along all the people who had contributed to our research at that point. We're just like, we're trying to raise money to launch this campaign. We promise it'll happen someday. And at the beginning of 2023, we got 4 grants in rapid succession to implement and actually launch PrEP for Teens, which was really awesome and very overwhelming. And it can be very easy for researchers like me to be like, cool, we talked to the community and got their perspectives on what they wanted out of a campaign, and then have the researchers actually develop the intervention. But Jim and I really did not think that that was going to work here. So we ended up involving youth very deeply throughout the campaign. We hired several of these youth who had participated in the think tank as assistants or interns. We call them youth leaders on our campaign. They create some of our content. They worked with our graphic designer, web designer, and artists to sort of make sure that anything that we put out there is very teen-centered. And we've done various creative workshops where teens will come learn about PrEP, and they'll do some art, and then they will see some of their ideas realized in the public art that we have. So 4 months ago, exactly 4 months ago, we actually launched Prep for Teens with a community event. So our website went live. We shared our first kind of art piece, which is this thing right here that I'm pointing to, at our partner implementing organization, Task Force Community and Prevention Services, which is an HIV service organization on the west side of Chicago that has been in operation for 30 years that primarily serves Black LGBTQ youth. So it was their idea to launch this event or launch this campaign with a ball. So we had this prep-themed youth mini ball. People walked in various categories. They got cash prizes for, kind of doing the most prep-themed things. And there was a pre-Thanksgiving dinner, and it was just, a really wonderful time. And ever since then, we have centered youth and community in our dissemination efforts. So some examples here are, here's Jim, who's gonna come up and wander behind me in just a second to give his part of the presentation. We were invited to talk to our local NPR affiliate about Prep for Teens, about adolescent HIV prevention. This is one of our youth leaders, Ryder, who got to speak on the radio on behalf of our team. This is a global Mosaic webinar where a couple of our youth leaders got to present on their experiences. And if you haven't visited our website already, these are some snapshots from it. The taglines, the FAQs, this provider map all came from Teens Ideas. So I'll hand it over to Jim, who will finish it off for us.
Thank you so much, Catherine, and thank you for having us here today. So just showing some love for our beautiful murals that were created by teens. So what are our next steps? So first of all, when Prep for Teens was all research, it made sense for that to live at Northwestern University. It is no longer all research, it is mostly implementation, so we are now moving stewardship to task force. So the project is in the phase right now of moving ownership, leadership, stewardship, funding, everything over to task force. And we think that's really important for both sustainability and equity, and for being on the ground where it counts. Cannot do that from the relative lofty perch of, lofty perch of Northwestern University. That building there on, I guess that would be whatever, you're right maybe, that is envisioning a new mural that we're going to be putting up there on the new space for task force. So task force has been serving folks in Chicago for 34 years in a very decrepit and challenging space, really run down. It's absolutely beautiful because of the people who come in, but the space they don't deserve that space. So they have bought a new building, and we're currently looking for funds, so we'll be asking for money at the end of this session. And that is, we'll be putting a mural on that building, give them something they deserve. So ongoing activities and next steps. So it's all about activation and dissemination. In terms of activation, we're doing these artistic workshops over and over and over again in different kind of configurations. We just started one with a group called Alma in Chicago. It's a 6-week arts fellowship led by a queer artist. They're gonna learn about prep, create some art, have a showing. We're doing something else with an organization on our far south side in a similar way. So the idea is that the organization that's leading this task force, it's not just a task force intervention or activation, it's a citywide thing. And again, in terms of sustainability, we are working with them now to raise funds. We do want to continue to get research dollars to evaluate and figure how this thing actually is working, but we need money to actually make it happen. So we're working with them to get grants, and then all of that money will go directly to task force. And I should just say, we are really excited about launching this Discord server. It was one of the things that the teens came up with, and I don't know about Catherine, but when they mentioned Discord, I had never heard of Discord. I could spell it maybe, but I was like, I don't know what that is. But I think our reaction every time was, we're not so sure, but yes, we'll do it. Now tell us how we'll do it. When they told us we'll do community murals, I frankly was a little like, I don't know, like murals in the back of my head, but I was like, yes, we'll do murals. And they have helped us figure that out, and here is another mural. Aww. This is another version of this mural. It's in the clinic space. It's called Explore Your Sexual Health Options. And all these slides, I think, will be available. So moving forward around activation and keeping things going, try to keep things simple is a lesson we've learned. I think that's a hard lesson, but we continue to do that. You have to be nimble And we couldn't have done this without a huge, huge village of people. We assembled all kinds of allies from different organizations, different stakeholders around the city who really helped us with connections. We couldn't have done it if it was just Catherine and myself and a few other organizations. It is crazy to get 4 grants at one time, but we somehow survived it. We're still here. Never underestimate bureaucracy. We heard about bureaucracy earlier today. Insane. I mean, just to get a mural up on a wall took one place a year. And we originally went into this thinking, oh, we're going to put murals under bridges. We're going to work with the Chicago Transit Authority. That's a whole other level. Just starting with friends you know can have a lot of bureaucracy. So never underestimate. And it's okay not to know exactly where you're going. Surrender to the flow. We often did not know what we were going to do next or how it was going to go, but we just had faith in listening to community and teens and making it happen that way. And here's some of the people we listen to regularly. We meet with our staff at Task Force consistently in person, not just on Zoom. We also conduct trainings and workshops to practice our prep speeches and our prep talk. And so things what we might do differently in hindsight. I think this first one is really important. We might have provided more structure to some of the consultants and people who worked with us. We were very structure-free, and I think we were challenged by that. So trying to find structure and keep creativity at the same point is super important. And then I mentioned this about art installations. Start with people where it would be easier to do rather than hard. And then finally, 5 takeaways. I'm almost done. Listen to teens. Take their direction. That's what we have done over and over and over, and it is so far working. It can be messy and hard and challenging, but this work, if you're doing community work and it's not hard, you're doing it wrong. Yeah. It has to be hard, but when you do it right and it's hard, it is so incredibly meaningful, much more meaningful than doing something easy and quick, which we could have done if we just got the research results and did our own thing. So it's incredibly inspiring. This has been like the joy of my life. These are the folks who make it so, and here's some of our contact information, and we look forward to seeing you all at our workshop this afternoon. Thank you.
Well, thank you. That was brilliant from each of you in so many wonderful ways, and kind of going with the sort of quote theme going, it reminds me of Maya Angelou's wonderful quote where she says, let's see, I wrote it down. I've learned that people will forget what you said, people will forget what you did, but people will never forget how you make them feel. And I could feel each of you in each of your presentations, and I think that just embodies what community engagement is all about and why you're doing it, why I think all of us are here today collectively, and it is by, for, and with the community, so thank you each. Now is the time where we'll be having, opening it up for questions. I don't know if they could show I had done a little graphic, but okay, this is just a quick thing. I got the slides yesterday and just did a quick little sort of what are the themes that kind of came up from their talks, and this is pre-listening to their talks and just seeing their presentation, so I'm sure I did not do this justice, but it's just a launching for talking about some of the questions we may want to have, really hearing a lot of the innovative outreach and engagement strategies that you were embodied in everything that you all did, these community-centered approaches, empowerment and agency, scalability and sustainability, which are critical in these, what we are trying to do here. And certainly we all have challenges and barriers to implementation, but what I loved is that you all talked about ways to address those. So thank you for giving those actionable strategies. So now is the time for questions, if anyone has any questions that they would like to ask. Thank you. And you can go back to the screen.
I'm Sean Pleasance. I'm a member of the UCLA-CDU CFAR CAB. I have a question for all of you. The thing that was apparent to me from all the presentations right now was the passion of the people with lived experience in these programs. So my question is, how do we help more people find that power?
Can you hear?
I'll take it. One thing I think is not so much about finding. I am always blown away at the intelligence, the strength, the passion that people of lived expertise have. I think what we need to do is to open the doors and cut out the BS. And what I mean by that is so much of the hiring practices across institutions and organizations do things that counter to what we know are situations that people who are placed at risk are placed in, right? And I think if we remove a lot of those things, we could open the doors for people to come in and do better work, right?
Thank you. I see, yes.
And I can you hear me? Yes.
Yes.
Hello. All right. So I have a little anecdote to address that great question. So when we did a workshop for that first mural that was featured in the windows of the organization that we were talking about, Task Force, we did a workshop on a Saturday, all-day Saturday in the middle of a hot summer, and we invited 12 youth to come. It was not hard for the organization to recruit these 12 youth. Mm-hmm. They came. I showed up 45 minutes early. There were already people there. And they were 100% engaged the entire time. They were not on their devices. They were not bored. They were not goofing around. They were invited in. They were taken seriously. They were given all kinds of agency, and they just flourished. Mm-hmm. And they came up with the tagline. They came up with the images. And now those same youth who were part of that are showing up at all of our other things as well on their own. So I think if you open the door and you make it inviting, mm-hmm. and you say, I trust you, mm-hmm. people stand up for that. I didn't know that teens would spend a whole afternoon on a Saturday in a hot summer in a hot place with no air conditioning, and they did. Mm-hmm. So I think we have to learn to trust and love up on our communities, and when you show them that, they come forward with more than you could ever expect.
Mm-hmm. Thank you.
Hi, everyone. My name is Karen Johnson, and thank you for your talks. The question is for Jim. You mentioned in kind of the reflective slide that one of the things that you might have done differently. Oh,
Yep.
vertically challenged. My name is Karen Johnson, and I was thanking everyone for their talks. And I wanted to ask Jim, you mentioned that one of the things that you might have done differently is more structure for consultants and other groups. So I'm curious about what that might look like practically, because I think some of the magic, if you will, happens when the process is organic, but what kind of structure, hindsight being the perfect lens, would you have given to consultants to better improve that process? Thank you.
Well, first I'll say, hindsight is magic, right? So when hindsight, you're like, oh, we of course would have done this. And I think our first instinct was to really, when we asked people to join us and they were willing to come on and help us with whatever part of that thing we were working on, whether it was developing our website or our social media strategy, we were very much like, what do you think? And do your own thing, and what do you want to bring to it? And I think that's good, but at some point, we had some veering, people just sort of going all over the place and leaving our kind of core mission. So I think we probably could have done better emphasizing over and over and over what our core mission was and what our core ideas were, and then leaving that room for creativity. But I think I'm going to acknowledge it's a very hard balance to strike, because at the end of the day, I'm really glad that we gave lots of leeway and that people came and brought all their own stuff to it that we couldn't have prescribed for them. So I think it's, again, it's the magic of hindsight. I think we would probably just check in a little bit more and be a little bit less loosey-goosey, but still trying to allow for that creativity.
And if I was to tack on to that, I was going to say it's the check-in piece. So allowing for there to be predictable points at which the conversation is happening. We do weekly check-ins with our community consultants, teams, et cetera. And we literally, sometimes people are like, man, we're just talking this whole meeting. I'm like, yeah, we're talking about how it's going, what's working, what's not working, what are your thoughts, what are your insights, where should we back up, how could we move forward? So I think that can be structured, not what's happening in those conversations, right? But literally allowing for that to be an ongoing piece of it. And that breeds really beautiful data too, as well.
Thank you. Yes, we've got 2 more questions and just a little bit between us and lunch.
Buenas tardes. When we work with communities, and I love we keep talking about bringing them in, when we work with people with lived experiences, that also brings lived trauma and language access barriers. And I'm not going to ask you all what funding is available, because that's not your, but what strategies are you all in your spaces developing or have developed to address lived trauma, language access barriers, and other resources or other barriers that might be happening in the communities that you're tapping into?
Somebody want to go? Okay, I'll start off a bit here. So from an ethical standpoint, the way that we do research in Shine and with our partners is always to think about what resources do we have if X, X, and X comes up, because we know that it's going to come up. So we have a live-in community resource compendium of sorts that we always have to be able to pull someone to the side and think about what resources this person has, who can we connect them to if an outside partner is needed, et cetera. And so that's just acknowledging that someone's going to show up and it's going to be like, I lost my house and I have nowhere to go tonight. Someone's going to show up and say that I was assaulted yesterday and I no longer feel safe with my partner, right? So I think it's always thinking about the ethics part of how you think about what folks may need. That's one. And I think the other part of it is thinking about your team, yourself, and others from a stance of humanity. If you're saying that your voice is important here because you have that lived expertise that came with trauma, that means that there may be ongoing trauma, then there also needs to be an acknowledgement of what are the institutional resources for people to tap into their care in terms of mental health and well-being, right? What does the check-in look like to ensure that people are okay? And just being rather cognizant of that and not just from a grind perspective. We do beautiful work, a lot of work, but it's hard work. So something that we do whenever we start off any meeting is a check-in. And that has nothing to do with work, but how are you? And sometimes those check-ins go a bit longer because people are like, it's been rough, what's happening with family, and tears start flowing, and we're all there, and we're talking about how we are as human beings prior to us talking about what's been accomplished and what we want to do with the work.
Thank you. So we have 1 minute for our last question.
I'm gonna try to get it done in 1 minute. All right.
Thank you.
My name's Steve Delson. I'm out of Nashville, Tennessee, and I represent my own rapid to this. I'm a professional barber, and I'm on a creative team with Vanderbilt University, Dr. Alma, where we create Cutting Out the Stigma barber-based program. And so I primarily deal with heterosexual males, primarily black, not exclusively, any of those things. And the thing that I wanted to ask or speak to is that, so I've been in this now for a little over a year, and I'm all into the work, and I'm all into developing a way, because I am a heterosexual black male in a barbershop. I know that if you approach heterosexual black males and just be like HIV, there's no more conversation. So as we've been developing our program, I've been leaning and guiding them toward health advocacy, because barbers were actually surgeons in our former lives before they split up the medical and the barber professions, right? So here's the thing. So like they have a grant, and, you know, I'm new to that. I'm a lay person, so I don't have none of these letters or nothing in my name. But the way grants or wherever the money is disseminated, you have to walk such a fine line within the whatever the scope of the money disbursement is, that sometimes it's been my opinion that it causes a block in ways that you can actually disseminate the message. so that you could draw people into the platform so that you could have the conversation. But if you wrap HIV, just to me, in a male health or sexual health type of thing, then you open up the opportunity to have all these other conversations with heterosexual males. So however y'all see that, whatever. Yeah.
Well, I think that was a great way for us to end our session, and really a great preaching from the barber, from the surgeon, and all of the teens, and as a mother of 5 adolescent young adult males. I will say I won't ever stand in the way of food for anyone. And thank you all for coming. And some notes, I'm sure there's extra notes, but for those of you who've been any part of our UAB CFAR IS Hub, we'll be having lunch over there, and I'd like to recognize Adia, Rana, and Lynn Matthews, and Karen, others from our hub too. Since I'm up here for a second. And that 5 Horizons, our community partner, is here.